As far as recovery goes from this procedure, most of it has to do with the actual placement of the implant. The implant almost always goes under the chest or pec muscle. Kind of the stretch of that muscle is really the majority of the discomfort the patients experience. It really just kind of feels sore, like they did a lot of push-ups. Usually about for the first few weeks, things are just a little bit tight and a little bit sore. Beyond about a week or so, patients are usually able to drive kind of no problem. Ultimately, it takes the implants a few months to settle, and usually about 3 to 4 months after surgery is the kind of final result that patients are looking for. So when the implant is placed under the muscle, a lot of times the muscle kind of contracts. The implant wants to sit a little bit higher than it should. So it takes a few months for the muscle to kind of relax. The skin kind of that got tightened up around the time of surgery kind of helps it just kind of relax, take on its own normal shape, and the implant will then kind of round out on the sides, kind of settle, and become a much more natural kind of position and shape. As far as recovery from breast asymmetry correction, it really just depends on what is going to be needed to be done at that time. A breast lift alone is a very quick recovery. If breast implants are involved, that's something that tends to cause a little more discomfort from the stretch of the muscle as the implant goes under the muscle large majority of the time. But usually by 6 weeks, patients can do pretty much most anything they want to do, but there's just a wide variety of procedures that can be done for asymmetry correction. So really just good communication with your surgeon and just laying out expectations and what those restrictions are going to be before surgery are super big keys.